This is the Now Morning Show here on TTT, and let's expand a bit on the coping with COVID conversation. According to the Minister of Health, Terence Singh, Trinidad and Tobago has been able to flatten the curve. What exactly does that mean, and what are the implications as we move forward into phase 2 and head to phase 3? Back with us is our very favorite doctor, Dr. Erica Wheeler, PAHO and WHO country representative in Trinidad and Tobago and the Dutch Kingdom Islands. Good morning, Dr. Wheeler.
Good morning to you, Lisa. Very good to talk to you again.
Always, always. So let's jump right in. What does it mean when the minister said we have flattened the curve? What does that mean?
Okay, so what it means is that in terms of the number of confirmed cases of COVID-19, they have gone right down in this case to zero. We have not seen almost for a month now any new positive cases. And of course, we have not seen any more deaths. So normally when they talk about flattening the curve, it means that there are less people who are becoming infected over a period of time rather than having a sharp rise or a peak like we see in some countries. So we have in fact flattened the curve because there are no more cases and there are no more deaths at this time.
Okay, so I know we'll be speaking about the steps that need to be taken to ensure the success of this flattening, that it remains, as well as the rollout of the recovery plans, particularly with regard to businesses. However, I want to ask you a bit about the statistics before we speak about that. While the number of cases approach 6 million, the percentage of deaths hover around 13%, say about 350,000, with over 2 million recovered. And internationally, there have been calls, especially in the UK, for example. So Rocco was saying yesterday on Hard Talk, why is there this lockdown of the economy, saying that the full lockdown is an overreaction given the actual mortality figures. You know, it's a question of lives versus livelihood, because businesses on lockdown could end up having an even tremendous negative impact on the livelihood of people. Can you weigh in on this a bit for me, Dr. Wheeler?
Yes. So, Lisa, yes, it is great news that there are so many people recovering. First of all, we have to remember that this pandemic is new. We are seeing new things coming up, for example, in children, like the multi-system inflammatory disease. We know that other things have been implicated. There have been talks about blood clots and mini strokes and new types of symptoms and so on. So we are still studying it. We don't know the full extent of it. But beyond that, remember, this disease, we were alerted in December. We're not even in June yet. But I understand the anxiety that governments may have, but I think it's a false impression to give that it is lives versus, it's the versus I have a problem with, lives versus livelihoods. The two must be seen together. That is why when we move from lockdown, which is to prevent the spike in cases and deaths, towards step-down measures, opening up the economy gradually on the advice of WHO, which says 2 weeks at a time, so we can see if there are any more cases. It is quite prudent to actually, it's quite prudent to follow the advice which says we must open in a way that does not endanger the lives of people, because if we don't know the full extent of the disease, we will not be very wise to sacrifice the lives of individuals, because it is possible there could be a second wave, for example, in Trinidad when the borders open. So it is not a versus, the two must go together. So in the case here where we have a roadmap, the country is being reopened, and we know countries are being reopened, or parts of countries are being reopened, but we also have to see the implications of that reopening and balance it. So it's more, I would say, it is more of a balance than versus. It is, I mean, the Director General of the ILO said this very clearly last week in a webinar, that it is false to say that it is one versus the other. It is not.
And you know, you're speaking about managing that reopening, and some alarming photographs and videos came out of the US this weekend for Memorial Weekend, with persons being on the beaches, yeah, and
Yes.
and Lake Ozark and so on. Should we be concerned even more because the world is so interconnected? Once the borders are opened back, are we? You know, it's we don't know what to expect. We come out of the summer period, go back into winter. They're saying that it can spike again. What do you say to all of this?
Yes, of course, there is a possibility of another spike, and my understanding is at least in 24 states of the US that there are still cases rising. And this is the example of what we were talking about, that balancing.
Yes.
And the public health measures, this is what worked in the Spanish flu. We have to observe the public health measures, which is the social distancing. We have the government says we must wear masks in public. We must observe personal hygiene and keep our environments clean.
Yes.
So those things will never go away until we find a vaccine. And even when we find a vaccine, there's no reason to relax personal hygiene. But of course, the picking up the virus from others could not be a death sentence, as it is in some people. And yes, I understand that the case fatality rate is not high, and every year between 12,000 and 61,000 people die of the flu in the US. But there is a vaccine for the flu. You can get vaccinated before the flu season starts. There is no vaccine for COVID-19. And any part of the world exists, it means that everywhere else is also at risk. So yes, we should be worried about seeing people congregating before we have got it under control or before they have got it under control in those areas.
Even the way we have here in Trinidad and Tobago, yeah? So let's come back to Trinidad and Tobago. We are in phase 2. And last week we started talking about what businesses need to do to ensure the safety of workers and customers. What does this look like? Yeah, for example, I have a question from a driver about ventilation. Maxi taxis have been asked to use natural ventilation, but rainy season is coming, is approaching, when they would need to use their air condition. So talk to us a bit about how this rollout, particularly with regard to hygiene, sanitation, air conditioning, for businesses and for taxis, maxis, and so on.
Okay, so there's been a lot of work going on and guidance being developed by various organizations. We have WHO developing guidance. I'll just read you the name of it: Considerations for Public Health and Social Measures in the Workplace in the Context of COVID-19. We have PAHO with UNOPS, which is the organization that deals with projects, the United Nations Office for Project Services. And we have got the International Labour Organization. So we've all been working overtime, developing guidance. And basically the guidance, if you look at it globally, it goes like this. First of all, you have to inform workers before they come back to work about what to expect. But you also have to look at your business, whether you're in the commercial sector or the construction sector, and there will be some differences between the two in terms of what workers physically do. So you have to decide whether they're coming back into a low risk environment, a medium risk environment, or a high risk environment. And of course, the high risk environment is those people who may come into contact with persons who may have COVID-19. Now, fortunately for us, that is not such a high alert, but we do have to divide businesses into how frequently the persons who work in those businesses come into contact with the public, okay?
Yes.
And on the basis of that, you make preparations by educating your workers, because yes, we talk about it a lot on radio and TV, but we can't assume that every single person coming back to work has a good enough understanding of the public health measures that need to be taken.
Well, we see it even just by the way people wear their mask. The conversation about how you need to wear the mask continues all the time in the media, but we still see people wearing it. I heard the term yesterday as chin hammocks.
Yes, I was quite amused by that. I heard the Minister of Health refer to it too.
Yeah.
And yes, it is true. People need to still understand how do you wear a mask properly. So they have to be educated about those things before they come back. And for businesses, they have to set up a protocol for when persons arrive in the workplace. Before they even enter, they need to wash their hands, for example, okay? And when people come in, you need to have a workplace that is laid out in such a way that persons sit further apart than they will normally sit. You know, they have to observe the distancing. You have to make sure maybe even that you stagger the number of people that come back to work to ensure that there is not overcrowding, well, not maybe overcrowding, but congestion in the workplace, depending on what your workflow is. So you have to study the workflow in your office as well.
Yes.
You have to make sure that persons who have underlying health conditions, that you identify those people and you don't bring them back first. So if there are possibilities for people to continue teleworking, you should do that. For persons like receptionists, for example, you can use plexiglass. You can have that as a barrier between the public coming in and that individual. So you have to study your workplace. And put in measures that protect both the public as well as the workers. You have to make sure that there are protocols set up for cleaning the workplace. Unlike before, where it might have been done casually, you have to train your work crew. You have to explain to them why they need to be doing this regularly. So at least twice a day, you should have surfaces cleaned, especially the ones that are more frequently used and so on.
Yeah.
You should have people assigned to check whether every morning persons come in, whether they have a fever, if they're not feeling well. If they're not feeling well, you should tell persons, don't come to work, call in. And if they are not well at work, there should be somewhere where they must report it. But in case they show signs of COVID-19, there should even be an isolation room where they can go to until arrangements can be made for them to get medical assistance.
Yeah. So it's a complete shift, you know. Dr. Wheeler, I know you come to us once a week, but I'm going to bring you back probably on Thursday, because we still have to talk about OSHA. We have to talk about mental health, communication in the workplace, and also cost implications, because obviously if companies are expected to do all of this, it's putting up of plexiglass by the receptionists and so on, that's going to mean additional costs. And I probably need to weigh in with our business people in terms of, would this cost, obviously some companies will say, well, this cost has to go somewhere. Does it pass on to the customer? So it's a systemic and systematic conversation about what happens next as we move into phase 2 and phase 3.
Yes.
Yeah?
Exactly. Yes, it is.
Yeah. All right. So I'm going to bring you back on Thursday so that we can continue talking about all of this. But Dr. Wheeler, I want to thank you so much right now for coming with us, PAHO and WHO country representative for Trinidad and Tobago and the Dutch Kingdom Islands. Our very own. We're owning you here on the Now Morning Show. And she's gone, but we love her to bits. We're going to kick it upstairs. Vidya is on the standby for the news to the top of the hour.